Hello and welcome back to Focus Atlanta. Thanks so much for continuing to watch. We're going to close out the show with a little more education, and this time it's education about HIV and AIDS awareness. I'm here with Dr. Miranda Ward. Dr. Ward, thank you so much for coming on the show.
I appreciate the invitation. Look forward to our discussion today.
Absolutely. You know, I think that sometimes people feel like out of sight, out of mind, because we haven't been talking about it. The issue of HIV and AIDS isn't still real for very many communities. So please, let's talk about it. Let's bring the topic up. What should we be concerned about these days?
Well, this is why we actually have many different national health observances. Like just this past February 7th was National Black HIV/AIDS Awareness Day for this very reason, because it's not top of mind for lots of folks. And so it is actually very important for this to be, something that we always consider, especially because I'll say as a Black cisgender woman, I'm actually a part of the subpopulation that has the highest number of new cases. Right? So if you think about just the state of HIV in the United States, actually, the CDC just released a report that showed that HIV rates overall have been stabilized, right? Which is, it's pretty good news. You don't want to see it, gonna go up. We want to see it go down, but it's been kind of stable. But there are very specific subgroups where that's not the case, where it's not stable, where it's not going down, it's actually on the rise, and that is Black cisgender women, and it's even higher if you're a Black trans woman. And so the question is, well, why? Like, what is it about, being Black, being a woman? And so there's a couple of things, right? We just talk about being Black. It's not necessarily your race that is making you, have an increased exposure to HIV, but it certainly is racism, right? And we think about the fact that Black people overall are less likely to even be offered HIV testing in a clinical encounter. You go in to see a PCP, of all the things that, that are talked about, HIV testing is not one of them. And so people may be sexually active and not know their HIV status. And if you don't know your HIV status and you're having sex, obviously that increases exposure because you're not fully aware of where you stand. And also there's a life-saving prevention drug called PrEP, pre-exposure prophylaxis, and so that's for people who don't have HIV, but they feel like, maybe I'm exposed to HIV. If I know that my partner has maybe increased risk for HIV, their, injection drug use, or, they actually have multiple partners, or I just don't know anything about their status, let me go ahead and take PrEP, right? Which is either a daily pill that you can take so that you stay HIV negative. And now the FDA just approved a new PrEP injectable, a shot, so that you don't have to, take it every single day. The pill fatigue is real, and then also there's a stigma associated with taking pills, and people are like, well, what's that you're taking, right? So for all those reasons, some people don't have that adherence to kind of taking it every day, which actually decreases the the effectiveness of the drug, of course. But now that there's a shot form, you only have to take it every 2 months, and it's released, time released, just like how birth control shots work. But that's the thing, depending on where you live in the United States, and this is also another thing that we see, that the rates of HIV are higher in the South. And you think about, well, where are there, Medicaid, kind of eligibility expansion, right? Some states actually haven't expanded that, so more people actually have out-of-pocket costs associated with their health care. And if you have out-of-pocket costs associated with going in and getting labs done and saying PCP every 3 months, then that's going to decrease the likelihood that you'll actually want to get tested or even get on PrEP. So for all of those reasons, those are some of the actual factors that increases the likelihood that someone would know their status, that very well may actually get HIV and then and spread it. So we also have to think about the fact that sometimes there's biased care.
Yeah.
If you are and I actually have been talking to clinicians. I do some work at the George Washington University. I do HIV prevention disparities work, and we actually talk to clinicians, and some of them say, I feel uncomfortable like bringing up sex or talking about sex to like an older patient, or they're married, you don't have to worry about it. But it's like, that's the thing, age actually is not a protective factor, marital status is not a protective factor. So that's bias, right? That's like age bias, marital status bias, and then of course there's racial bias and gender bias, right? So all of those things combined, not to mention other factors of not being able to have adequate housing and employment and community safety, what we call the social determinants of health. All of these things combined are increasing our exposure to HIV.
Wow. Well, then I can't let you get out of here without giving us a few websites, places where we can go learn more information, get in the mindset of erasing the stigma by learning and educating ourselves.
Absolutely. And I'm glad you asked that. We're all inundated with so much information at our fingertips. We swipe left and right, scroll up and down, but you don't necessarily know what are the credible websites. Yeah. Anything.gov is credible. Okay. So CDC.gov, right? HIV.gov. These are places that literally you could type in your zip code and they'll actually tell you where you can get free HIV testing, how to, really, what are the 5 fluids that actually, would expose you to HIV, right, which would help to curb some of the stigma and misconceptions about how you can get HIV, which is, a really important thing to know. And like I mentioned, some of the work that I do at GW, so I have a program called 2-in-1, which is trying to routinize HIV prep and COVID vaccine screenings in one primary care setting. And so 2-in-1, spelled out TWOINONE.SMHS, which is School of Medicine Health Sciences, .GWU.edu to learn more about the work that I'm doing.
Thank you so much for your time. Thank you for the work that you're putting in. It was good to see you.
It was. Well, thank you so much for the invitation.
Absolutely. All right, guys, we can stay educated. We can stay informed about the things that we can do in our lives personally and the things that we could tell our friends and family members to keep them healthy as well. Thanks so much for tuning in to this week's episode of Focus Atlanta. I hope to see you next Sunday here on WUPA.